Hi, my name's Caitlin Bland. I'm currently a medical oncology nurse at a roughly 600 bed hospital. We have 41 beds on our floor. We see a lot of cancer patients, hospice patients, end of life care. We also have a diverse medical floor, so we kind of get a little bit of everything, more focused on the cancer side. Um, I'm currently a charge nurse on my floor. I've been a nurse for about 2 years and I've worked there for about a year and a half. It was really my first hospital experience job. Um, with my leadership questionnaire, I scored high in pretty much everything. I scored the highest in interpersonal skills. I need to do some work on my administrative skills. Well, my current charge nurse position, I don't really do the administrative side. We'll occasionally do like some paperwork or fall report or something like that. But for the most part, I do not have to do the administrative side. During my shift, there aren't any managers or really anybody on the floor besides me and our floor nurses, because I only work on Saturdays and Sundays. We do have a supervisor in the tower, but she works. We have 10 floors. We're the 10th floor, so she is a very busy lady. Um, so I do need some work in that area. Basically, my role is making sure that the staff has all the tools that they need to succeed during the day, whether that's making sure they have the catheter on the floor they need. They can call me and be like, I can't get a hold of distribution. I can't get this. And I will find a way for them to get it. Sometimes it's not always being the nice person, but we find a way. Also, if they need help on a nursing judgment situation, if they need basically anything, they'll call me. We do use a team nursing model on our floor, which does help. And sometimes if two people are having a busy day and they're partners, they'll call me and I'll be their backup if they need it. But I believe that in nursing, general nurses typically feel overwhelmed, but feeling like they have that backup, it helps them complete their job and make them happier, giving the floor the staff they need if you have a happier staff. And my job helps achieve that. Um, our current organizational structure at our job is we have a manager that's pretty much on top of our whole entire floor. And then we have an administrative coordinator, which is right under her. She handles the schedule, all the paperwork aspects, that kind of stuff. And then we have the charge nurses, which is what I do. And then we have the floor nurses. Um, so since I only work on the weekends, I kind of play the role of everything, but what I normally do is at the end of the week, I call the administrator coordinator and I give her an update on everything that's happened for the week. I don't really have any interest in going higher management at my current job. It is a hard floor to manage. It is a medical floor, so medical floors in general are they're hard to get staffed. A lot of people use our floor as like a starting position. We have a high percentage of new grads, which is actually what I did when I first started working there. And usually the turnover is about 2 years, so they constantly have people coming in and out. We have a couple people who've been there a little bit longer, but for the most part, if we get somebody to stay 2 years, it's a pretty good achievement. Um, and that it just doesn't play. I just have no interest in doing it as far as management goes. Even though my manager does do a very good job considering what she's given. We do team nursing on our floor, which I think I mentioned a little bit earlier. Our administrative coordinator just transferred from a charge position to the administrative coordinator position, which I think is a little hard because our administrative coordinator plays a very strict rule. They make sure everybody does what they're supposed to do. And as a charge nurse, people kind of view you as your friend because you're able to call her if you need help or for this or that. It's kind of your buddy. And when she went to that AC position, it was a very difficult transition. Um, I think areas on my floor personally that need some improvement are, well, let me start off by saying we have a horizontal structure. So everything kind of has their own department. If you need anything from um, distribution, you call distribution directly. You don't talk to your manager. You just get it done. We have transportation, we have lab, we have radiology, and the radiology is divided into like 6 different areas. You have CT, X-ray, then MRI. They all have their own departments. Everything is separate. You call those people. If you call the wrong people, they don't know. So I actually enjoy that structure personally because you know who to call for what, and 9 times out of 10 they can answer your question when you call because it is directly their job to know. Um, but the areas that I think our hospital needs some improvement on as far as management goes is distribution because we have a lot of issues getting stuff to our floor when we need it. And we had, for example, we had a code going on, and the doctor wanted plate or plasma stat, and we didn't have any plasma tubing. So this was a big ordeal, and the distribution people were dragging their feet. It was just really, and this happens time and time again at our hospital. Also, another area I found that we need improvement in is transportation, which is an awesome service. Have somebody pick up our patients, take them where they need to go, and bring them back. I mean, it's awesome, but a lot of times the employees will pick them up or drop them off and not tell the nurses. So we're not able to assess our patients after they come back from procedures or tests or whatever it may be and get their vital signs in an adequate amount of time because we don't know that they're back. And I feel like it's because part of it is their management not training properly, all that stuff. So it definitely could use some more work. Um, Thanks, guys.